Great. We just want to make sure everybody has this information if they weren't able to make the call today. So welcome to the SHIP American Rescue Plan pre-award update. We've gotten a lot of good questions in already, and based on feedback, know that this was kind of an important conversation to have, so appreciate you being here today. We don't have answers for everything. I know there's some questions that we have in the email box that we are still working to get answers on. So those questions we won't have answers on today either. But just it's helpful to hear the questions that you do have. We want to make sure to share the answers that we do have back with you. And we also want to use this time to kind of talk more broadly about some things where we really appreciate what input you have. So I will share my screen, and this is my first time using Zoom. We just moved to Zoom recently in our office. So when I share my screen, then I can't see what's going on in the chat. So I appreciate Janine and Rachel kind of making me aware of what questions are coming in. Okay, so let's get my screen shared. Okay. So first of all, I just want to say thank you. I know with this funding request comes a lot of work on your end as SHIP coordinators and for the hospitals to think about things as well. So I wanted to do a thank you slide to kind of kick it off. And I saw this one that included kids spelling out the word thank you, which kind of really highlights the effort and time that it's taking all of us as people to get this program out there. Also, kind of the context of that, you know, across government, there's a real interest in getting support out to rural communities. And unfortunately, there's not a lot of direct grant programs to many rural providers. So while the Bureau of Primary Healthcare has those direct grant making relationships already with community health centers, we don't have the same thing with rural hospitals or rural health clinics. So that's why we end up with these kind of put together programs. So for SHIP, the SHIP grant is the one where there's kind of the most access to all rural hospitals that are out there, which is why through the CARES Act, and then again through the American Rescue Plan, tapping into that existing resource, which I know might not be the most efficient way than getting funds directly to hospitals, but it's kind of using those mechanisms that are already in place. So just wanted to kind of mention that. I know on our end and on your end, things would be a lot easier if funding could get out to hospitals, but we really appreciate all the work you've done, and then, you know, what this means going forward to continue to get funds out to support hospitals. So today we will, I'll talk a little bit about the background of the funding. I know this ARP funding is a little bit different than the CARES Act, and kind of explain why there's more limitations here. Talk about the upcoming June 9th due date and what we need by then, and then get into a little bit about the program activities and processes for this ARP funding. And then finally talk and kind of gather input from you on the hospital reporting, because that's something that we're still not clear on what that exactly will look like, but having your input on that will be really helpful as we move forward, kind of planning that part of the project. So just background on this specific funding. So HHS received a lot of funding through the American Rescue Plan. So that funding is being doled out across different programs in HHS. So, and it goes towards different activities. So the section of the ARP where we receive the testing and mitigation funds is from section 2401. So that's funding that's targeting activities specific to COVID-19 testing, contact tracing, and mitigation activities. So that's why we're limited to that scope of activities. So there's other funding that HHS is getting out for vaccine distribution and other types of COVID-related response. But the funding that we're authorized under for the ARP is just specific to the testing and mitigation. So that's kind of the one piece of it. Then the other piece of it is, you know, we get the money from ARP, and then we have to also figure out within the Federal Office of Rural Health Policy, what is the authority that we have to get this money out? So we have, as a broader authority of our office, is section 711 of the Social Security Act. So that allows us to administer grants to support activities related to improve healthcare in rural areas. So that context of healthcare kind of means looking at things from that system level and less on the individual outcomes level or more health service delivery. So why is this different from last time? With the CARES Act funding, we received funding in the CARES Act legislation that specifically directed it through the SHIP legislation, but included the language notwithstanding of those elements of the SHIP grant that kind of limited the scope. So that gave us much broader ability to kind of fund the broad scope of activities for COVID-19 response. So I know there's a lot of questions from hospitals, and that was really flexible under the CARES Act. So I just wanted to provide you a little bit more background to understand why there's these limitations. We wish we could open it up a little bit more. And so hopefully this will help you kind of to understand it and then be able to communicate with your hospitals as well. So within the context of COVID-19 contact tracing, testing, and mitigation, we're trying to be as broad as possible there, just to help hospitals kind of figure out how to maximize the use of their funds. Okay, so items that are due June 9th, not July 9th, June 9th. So the Excel spreadsheet template that we sent out include all the hospitals that are participating for your state and submit that to the testing or SHIP testing at HRSA.gov email. So should be pretty straightforward information that you already have for the most part. And then I know you're working to find out from your hospitals which ones are participating. So unfortunately, this is a really tight deadline. So we don't have the capacity to allow extensions. We have to get this information really quickly up to our colleagues in the Office for Financial Assistance Management so they can start processing the awards to go out. So if you have any questions or concerns, please let us know today, Monday, just so we can kind of talk through any concerns that you have and make sure we're able to help you meet that June 9th deadline. So just kind of revisiting those funding timelines, because we've gotten some questions in on this as well. So we anticipate that notices of award will go out July 1, 2021. And so this is like with the CARES Act, where you'll get the award with the amount based on the number of hospitals that you submit to us. And then there'll be that request for information that comes in after the fact. How you get that money out to hospitals, we don't have a preference of how you do that. It's kind of whatever standard processes you already have set up in your state or what you find will be useful for this time. So you have kind of a lot of flexibility there. For the project timeline, it'll be July 1st, 2021 through December 31st, 2022. Some hospitals may spend their money a lot quicker. Others might use that time to kind of think about what they want to do and think more strategically and plan for activities over the course of that time. And then hospitals may also use their funds for supporting activities retroactively back to January 1st of this year. So any allowable activities that they had already kind of implemented, they can use those grant funds to reimburse themselves. Okay, I guess I'll pause there before delving into the next section, just to see if there's any questions that anyone has. So either from the chat or just feel free to unmute yourself and ask questions as well. So I see one from Kyle. Is there a hospital application similar from COVID SHIP and SHIP? So in the email that Janine had sent out, we had a template for that states could potentially use to send out to your hospitals, just with that information. But basically what we're collecting from you is just a spreadsheet, like their hospital information on the spreadsheet. So I don't know if Kyle, that answers your question. And then Alia, if we have particular questions about allowable activities, yeah, so we'll talk about that next. So you can type them here. But if you already submitted a question, some of them take us a little bit longer to kind of make sure we have addressed. Okay. Okay, so for activities. So these activities, it can be anything for addressing an immediate need or supporting longer term planning for COVID and other infectious disease mitigation. So I know we've been hearing from folks that hospitals don't necessarily feel like this specific area of focus for this funding is really relevant to the needs that they're facing immediately. But you know, COVID is still around, so testing is still going to be needed over the next 18 months. And then there's also those kind of longer term strategies, whether it's thinking about mitigation activities and planning within the hospital, or you know, how the hospital can support the community in those efforts. One of the things that we made sure to highlight as the example activities as well was thinking about how to support staff through kind of that stress and burnout situation, which I know a lot of providers have been dealing with. So another option would be kind of thinking more long-term planning of what a facility could do to kind of focus on that and build programming in for staff support around stress and burnout. You know, this is also a very limited focus, and we've heard it's really vaccines where the need is. Unfortunately, we can't fund vaccine purchasing or dissemination and distribution, but education around the importance of vaccine for community mitigation, both within hospitals and kind of the hospital partnering with the community and other providers in the community, is allowable. But one thing I did want to mention there, kind of focused in on, you know, our authority to provide support for healthcare. We can't support any kind of incentive for individuals or groups around that. So like gift cards wouldn't be allowed, or I know a lot of states are figuring out like lottery systems or kind of giving away freebies. None of that stuff is allowed here, but education and kind of the marketing campaigns around that education piece would all be allowable. You know, it seems like there's questions of just how hospitals would be able to spend these funds. So what we plan to do is just collect information and then share it back to you. We've already gotten some examples in from the FAQs of how hospitals are thinking about spending it. So through that, kind of give out ideas of here's how someone else is spending it, so people can see what might be relevant within their hospital and community as well. So we will kind of in the short term get these out through FAQs, and then TASC will be putting them on their website as well for easy access. And I'm looking at the chat and I see there's 14 questions that are coming in. So let's delve right in. Okay. So let's see, are we going to request any validation expenses back to 6/1/2020 to present that have not already been reimbursed? So all that we're collecting on our end is that for the current SHIP CARES Act program is the spreadsheet of where each hospital has spent by category. So we're not going beyond that. Whatever information you collect at your state level for contracting processes, you can do that. But from our perspective, from the Federal Office of Rural Health Policy, we're just capturing information about the like how much per category. However, for equipment, we will be collecting for any hospital that purchased equipment, which is anything over $5,000. There will be a spreadsheet that we collect that information on. And then for the minor alterations and renovations, there's that specific paperwork that's due as well. But beyond those two things, it's just the spreadsheet. Okay. Yeah, so for doing subcontracting, the goals of this is to support testing and mitigation activities. So if part of meeting those goals means the hospital is subcontracting some of that out, it should tie back into whatever that goal is and kind of support the overall efforts of the hospital. But however the hospital deems that to work best for them, they can use the money accordingly.
Christy,
and the funding be used to support community health workers. Yeah, so we, again, it's less of, for this, like it's just thinking about how does this tie into the overall goals of supporting COVID testing or mitigation activities.
Oh, Christy, sorry, this is Alia. The reason I asked about the community health workers and EMS agencies and things like that is we're thinking about those who are isolated or quarantining, and how do we support those folks? So, you know, just doing some of the monitoring and check-ins, as well as connecting them with like grocery delivery if they're food insecure and don't have access to somebody else to drop that off. Those kinds of activities, would that be a supportable, because that's the mitigation of the isolation effects. So, or with EMS agencies thinking about using it as a mobile integrated healthcare entity so that they're doing some of the oxygen monitoring for those who are kind of borderline, or we know that they have a chronic disease such as diabetes, and they may need some closer monitoring as they're isolating at home, so that we can track if they're doing okay or if they need to be then hospitalized. So that was those kinds of work, and those were the kind of the subcontracts I was referring to as well, right? If there's an agency that's already a mobile integrated healthcare agency, can you provide them funding from the hospital?
Oh, okay. So all of this is through the hospitals. So the funding is distributed to hospitals, and then however hospitals deem it makes sense to use.
Yeah.
So the hospital could partner up with others to kind of support these efforts, but the focal point being the hospital.
Yes.
And then for like for community health workers or EMS, I think it's mitigation is around mitigating the spread of the disease. So less focused on supporting those in isolation, but if it's supporting efforts to mitigate the spread of diseases, however that makes sense to be done, that is likely allowable. So, you know, I think what's helpful for us when we get questions in is to see things framed kind of directly how they tie into those goals that were outlined of the testing and mitigation activities. So I would recommend to all of you too, as you get questions in from your hospitals, kind of ask them to frame it to you in that way, which helps because, you know, we're not experts in terms of how these activities are kind of carried out in the community. So if we just get a question in and don't have the context, it's harder to figure out how it ties back. So if things are framed as, here's what we want to do, and here's exactly how it directly ties in to either testing or mitigation, it's much easier for us to think about, yes, this is allowable and makes sense, or no, this really is outside the scope, or we don't see how this directly ties into those activities. Because, you know, we know there's a lot of needs out there, and this amount of money, there's so many different ways that I'm sure hospitals would rather spend the funds. So we're really trying to hone in on those things that directly tie to testing and directly tie to mitigation, which is broad, but, you know, for example, there was a question of, can we do a mobile clinic? Well, you know, it's easy to say yes to something that directly ties in to testing or mitigation, but generally, if it's just kind of setting up a primary care mobile clinic, that's not within the scope of what these funds are intended for. So, you know, I think for your roles as SHIP coordinators, as much as hospitals are able to define it for you, how it ties into the goals directly. And then for any questions that need to be sent back up to us, it really, really helps to have that context for how it can directly tie in. So I don't know, Janine, if you have anything else to add on that, but I know like the variety of questions that we get in, it's just things that you wouldn't even expect that hospitals have ideas about. And a lot of them fit right in and they're great. And some of them, it just seems like a little bit too much of a stretch. And while it is a great activity, just seems a bit out of the scope. Okay, so going down, can hospitals submit their application as a group or do they need to submit their application separately? So again, all we're collecting from our end at the federal office is just all those hospitals that are interested in participating. And that's how we will determine the amount that each state gets. So whether hospitals want to kind of work together, I don't know, like at the state level, I don't know how you would organize that. It seems like it would just be easier to have each individual hospital submit an application because we're awarding money to states and then each hospital should be getting that full amount outside of any administrative fees or administrative costs and indirects that the state is taking.
Hi, Christy, this is Nicole, and I asked the question.
Okay.
It's because some of our, we have 5 hospitals under one health system.
Okay.
And that's where the question has come from, is
Okay.
that whether they can do the application and work on a shared project, or will they have to submit each application separately? So that it was just waiting for further clarification before they sent in their yes or no if they're going to participate.
Okay. So I think that would just be up to how you prefer things within your state processes. Because from the federal perspective, we would just view it as 5 separate hospitals that we're funding. But however they decide to pool that money or not, it doesn't matter from our perspective.
Thanks.
Does that help?
Yes, it probably doesn't help me, but that will help.
Yeah.
Thank you, though.
And if you want to have more conversation about it, we'll be happy to follow up with you after.
Okay, thanks.
Okay. Yeah, so if a hospital is part of a group, does education have to be specifically branded with the awarded hospital information, or can it only be like the group? You know, from our perspective, again, it doesn't matter. I think it's however works best for that hospital or the system that they're a part of, whatever processes they have. So whatever works best for them. Would employee bonuses be allowable as a burnout strategy? You know, that's a good question. I think we'll have to confer on that a little bit more. So we will send follow-up information on that one. Can efforts such as screening patients when they arrive count for the cost in terms of staff time? I think, you know, tying it back into a mitigation activity, if the hospital can do that, then that would count. Can the use of a home health or hospice agency be supported with these funds? Yeah, so we had another similar question of kind of for the testing of staff there, and that can be allowed. And then, you know, in terms of mitigation for that support for isolation of individuals, it's again thinking about like what are ways that these funds could be used to kind of support the system versus focusing on specific individuals. So however hospitals think they can tie it back to that goal would be allowed. So for the vehicle purchase, like vehicle for testing, kind of going out and doing community testing, that would be allowable under this program. Okay, will funding be available for COVID-19 monitoring programs? Yep, so that's part of mitigation strategies. Can the grant cover the cost of a creative agency to develop additional materials to educate? Yes, education is allowable under the grant. Can the hospital purchase equipment to bring testing into house? Yes, that is covered under testing. Could a care coordinator be covered by these funds for mental health angle? Yep, that kind of covers that education piece around the COVID and long COVID. Yeah, these funds will cover staff to take the tests back to the lab and do contact tracing to allow for quicker contact tracing. For mitigation to kind of more broadly address mental health issues, I think kind of looking at those mitigation strategies and seeing how it can directly tie back. If it directly ties back in, then yes, but just, think about what that direct tie-in is. I know there's a lot of kind of more broad impacts from a lot of this. Yeah, can ED renovations to accommodate positive patients? So this is, for the testing and mitigation, it's focused on what are the minor alterations or renovations that can assist with testing or mitigation, but less on the treatment side. So I think if it's around kind of being able to accommodate positive patients and isolating them, then that would be allowed. But in terms of those negative pressure rooms, that would be, more of that treatment component and not for this specific grant funding. And, we have included language around what is minor A&R, and expanding the square footage is actually renovation or is a construction project. So that is not allowable under this grant. It's just minor alterations and renovations. Yep, so Kyle, we will be sending out an updated FAQ. May funds be used for simultaneous multi-testing that includes COVID? Yes, funds can be used for that. Yep, so what we'll be doing with the FAQs is sending out an updated email or updated version through email. And so we'll get that out probably by Monday morning on this. And then we will also continue to update them as we get more information, and they will be posted on the task website as well. So Catherine, I see you have a question on salaries and fringe. Is that at the state level or the hospital level?
Sorry, I had to find the unmute. A couple questions on that. And I think you've answered that, some salaries and fringe for the hospital staff are allowed if it's related to testing or mitigation, correct?
Correct.
Okay. And then my other question was on indirect. Our university, of course, is going to want to know if they can take any indirect on the grant. Because you had mentioned wanting all the funds to go right to the hospitals. Yeah. So do you know if that's allowed?
Yeah, so we have under the 7-Eleven authority, there is not that 15% cap on indirect that we have with the usual SHIP legislative language. So what we have in the instructions that will go out is language saying, the intent of this program is to support hospitals. So states are encouraged to get a minimum of 85% of the funds out to hospitals. So, we know that there's going to be administrative costs at, managing this program at the state level. But given that it's such a significant amount of funds, encouraging states to really see what they can do to try to get as much of that money out to hospitals directly.
And what did you say that minimum amount was? I missed that.
So it's 85%. So kind of
Great,
encouraging
thanks.
the same that the SHIP grant would be.
Thanks.
Yep. Okay. So what happens if a hospital agrees to participate initially, but later on changes its mind? We'll push the money out through the notices of award. If a hospital opts out at some point or doesn't spend all the funds, we will kind of issue an updated notice of award to the state. So pulling that money back in to HRSA. So just keep us updated as you find this information out. And then we will work with you to get the awards updated in your state. May funds be used for greeter or COVID screening staff at the facilities? Again, if it's tied into specific mitigation efforts, just, encourage the hospital to let you know which one they're thinking it links up with. What are the exact counties or zip codes that qualify as part of the grant? I assume eligible hospitals can spend on any area in their service area. So for the SHIP eligible requirements for the hospital, it's critical access hospitals, and then hospitals 49 beds or fewer that are part of a FORP designated rural area. But in terms of the service area of the hospital, they're not limited to any specific locations. It's kind of whatever the service area is of their hospital. Does that get at your question, Misty?
Yes, that's what I assumed,
Okay.
but that was what us hospital
Okay.
specifically asked.
Okay, so the only reporting required will be done by the hospitals. So we'll get into the reporting in an upcoming slide. Yeah. So will we need to use the SHIP TA for questions on eligible activities? Will there be an entity we reach out to? Yeah, so right now, the SHIP testing at HRSA.gov is the email that you should be sending all your questions to. So right now, that's myself, Janine, and Rachel that are monitoring that. We will be working with our colleagues at the Technical Assistance and Services Center. I know they've provided a lot of help as questions come in on allowable activities. So we've been talking to them just to see, how we can try to set up a similar structure, which has seemed to work well, of making it easy to see what's allowable or not. But because everything's been moving so quickly, we haven't been able to set that up yet. So for now, contact the SHIP testing at HRSA.gov. If you do happen to send a question over to our colleagues at Task, they may know the answer or they'll direct it over to us too. So yes, staff time on testing is allowable. And SOAR salaries and fringe are allowed. There is the staff time that it takes to manage these contracts within your state. So that is allowed. And then Catherine, I answered that question already on the indirect. For alteration and renovations, if a hospital does not use a contractor and uses their own maintenance department, do they still need to fill out the template forms or certifications? I would say yes, because I think that's standard for all of the activities related to alteration and renovation, but we can follow up just to confirm. Can these funds be used for other mitigation activities for other infectious diseases? Yes. So we really encourage hospitals to think kind of broadly strategically about those mitigation activities, including COVID, and thinking about other things as well. Yep, so we will be adding these to the FAQs. Would COVID-related sanitation equipment be eligible? Yes, that falls under mitigation. Would the cost of building an interface to allow for direct upload to the EHR wherever testing info needs to be reported? Yeah, one of the allowable activities for testing is around kind of building out those IT systems. Oh yeah, thanks Andy for putting that information in on the new website. It's so helpful to have all this information in one place. Yeah, so that up to 230,000. So this is what we are awarding to states based on the number of hospitals that are participating. So whatever costs you end up taking out at the state level will reduce that number to that ends up going directly to the hospitals. So I know some states aren't taking anything or didn't for the CARES Act. So the hospitals receive up to, receive that full amount. Other states have the costs are kind of required taps from the state level. So it ended up being a little bit less for hospitals. So it's the same thing this time. So from the Fort perspective, we're giving each state 230,000 per hospital, but you may end up giving less to states. Okay, yep. Thanks, Stephanie. I see you answered that as well. So hiring staff is listed under the testing heading. Would that include advertising, recruitment, or just salary and benefits? It can cover anything related to staffing that ties in directly to the testing component. Okay, I think, did I get all the questions?
That's all that I saw in there.
Okay, great. Really good questions. Okay, before I move on to the next section, any final questions on activities? Okay. Okay, so for the reporting, kind of the same with the CARES Act, we will have required reporting for all equipment that hospitals spend. So that'll just be kind of one end of year report out. So just a spreadsheet by hospital kind of outlining. So the state just submits one for all your hospitals, kind of consolidating all that information, just a listing of the equipment that they have. So I know Rachel and Janine are working to kind of streamline that for this current CARES Act closeout, and we'll be using the same streamlined process for the ARP report out as well. We also have the minor A&R, alterations and renovations, which I know that information, we having never funded a program that did anything like this, it was kind of shared after the fact, which I know was confusing for all of us, and I know frustrating for the hospitals and you. But it'll be the same forms this time, kind of streamlined, but we thought just collecting that information from you on a quarterly basis. So whether it's, just all the hospitals that are working on those projects, whether it's just the initial proposal or if they've completed both things, just on a quarterly basis, just to make sure we have that documentation for tracking. So that's just if you have hospitals that are, within that quarter have done, are planning to do a minor A&R project. Any questions on that? Those two items?
Kristen, Chrissy, are you saying that the hospitals will actually go in and do their own reporting in this portal, or will it fall back to the SHIP coordinators to collect the hospital information and then enter it?
Yeah, so for the equipment list and the minor A&R, and thanks for that question because it's not clear from the slide. So that's through EHB for like the grants tracking. So you'll do the equipment list at the kind of end of year closeout. And then for the minor A&R, you would collect it from your hospitals and then report that into EHB quarterly, if applicable. So, and then for the hospital level reporting, which for the CARES Act, we had done through the spreadsheet format, what we're working with colleagues in our office to try to do for this time to streamline it a little bit is have a web-based form that the hospitals would fill out directly. So hopefully that'll kind of reduce the burden on everyone from collecting all that information and then rolling it up in the Excel spreadsheet. They can just go to this web portal and put the information in. However, we haven't had a chance to kind of dig through the specifics of it. So I just wanted to lay out kind of what we're thinking on the big picture, and then use this time to hear what thoughts you're having about it or concerns you have as you think about it. Just so we can have that information once we start those conversations. So our goal is to just minimize the burden on hospitals and states for this. But we know it's important for you to see what your hospitals are submitting. So we definitely will build in that component so we can share the information that we get about the hospitals back with you, so you see all of the data from your states. Let me just pull up the chat and see what questions. Yep, so I'll get into this on the next slide.
Christy, I have a question as well
Yeah.
about in terms of the hospital activity.
Mm-hmm.
Is there gonna be like an approval process from HRSA before the hospital submits that activity? Because so what happens with the CARES Act funding
Mm-hmm.
is that hospitals submit their information to me, and then I just double check that that is okay, and then they are approved to like submit it as an expense to that funding.
Okay.
I guess my concern is they're gonna be a little anxious not having that double check that it's allowable. That's why I have 15 different questions from hospitals already. So how is that process going to work, or should we encourage them to talk to us first and then submit? Or
So are you saying you would look at the Excel spreadsheet form that would end up getting sent back to our office?
So what I usually do with the CARES Act is they email me what they want to put into that spreadsheet.
Okay.
And they say, listen, I spent $15,000 on this and this, just double checking that's eligible. And then I put it into the spreadsheet for the CARES Act, and quarterly I give it to you guys. But this process, they're going in and doing their web-based thing. But I want to make sure that there's going to be a check at some point that that's approved and is okay, so that they don't get worried that they're going to put something in and then it's going to be not eligible, and then they're going to be doing this roundabout.
Yeah. So what the way the current spreadsheet works and how we anticipate this new one would be is it's just kind of the broad categories. So from that Excel spreadsheet in the CARES Act, it's just the boxes of the different kind of example activities that we had included there. And for this one, it would be the same thing too of, you have the list of example activities that we sent out. So it would just be another box kind of broken out like that with those broad categories. So we're not going to get kind of the specific underlying payment categories, I guess, just the broad categories.
And I would say I'm sorry, go ahead.
No, go ahead.
I would say we do the same as Aaliyah was, I think, sharing, because like the hospitals will send in their invoices of what they spent the money in, or sometimes they'll call before they even send the invoices in to make sure it fell within one of those categories of the previous funding. And then if we'd either yay or nay it or send it to HRSA to get their feedback on whether or not that was approved. And then we would just collect all those approved invoices that we've already reviewed. And then when the quarterly report becomes due, then we go in and fill out that quarterly spreadsheet and submit it.
Okay.
But I think if I'm hearing you correctly, the hospitals are just now going to go to their portal themselves for anything that's not equipment or minor a renovation, and they're going to click on what boxes they've used the money in. Is that what I'm hearing? I think that's my concern if they're going to do it, because we haven't said, yes, this meets the criteria for you to spend the money on.
Okay.
And I think the second point I would maybe make too is I'm involved because I'm also the SOAR. So I'm involved with the rural health clinic money that they got last year for like 49,000, and now they're getting like 100,000, where they have to go to their own portal every month to indicate the number of COVID tests they did. And we're spending an enormous amount of time chasing down those clinics that aren't doing the reporting. So I guess my other concern would be when they don't do it, then who's it going to fall back on? I assume it's us to track them down and get them to do it.
Yeah. Yeah. So I think like on one of those points, for the data, it's just for us to capture how that money has been spent. So if from the state perspective, you're pre-approving how they spend it going forward, when we do our reporting updates, they should only report in anything that they've already been approved to spend from the state level.
Christine?
Is that
so? When would we approve it though? If they're just going to go in and do their web reporting, we would have to develop a process for them to send them to us before they go to their portal to enter it.
Well, how did you do it with the existing Excel spreadsheet that we have?
One, they would either send in invoices and say, this is how we've spent the money. And we would look at it to see if it fell in one of the appropriate categories. And then we would approve it. And if we had any questions about that, either go back to them or go to you to say, hey, was this really an allowable expense? And then at the end of the quarter, we have the list of all the expenses that actually are approved. And then we would put them on that spreadsheet. But we always made sure that it fell in. We defined what category it fell into to begin with.
Okay.
And then because they would just send an invoice in that would say, I don't know, I can't even think of anything. And they wouldn't look and say this category. They're just saying this is what I spent the money on. So then we would look at all the categories to determine which one it would fall into. And if we questioned what one it would fall into, then we would go to you and say, does this fit into what we're thinking here or not?
Okay. Yeah, I see what you're saying. Joyce, what state are you with? Can you remind me?
Sure, Indiana.
Indiana. Okay. Because this is kind of what we're trying to figure out for the next steps too. Oh wait. So for the reporting framework, like what works well for the states? And it seems like having that budget, having the numbers broken out by category is really useful for you. We've heard. So rather than just having them check a box on that reporting system, like actually put in the amount of money for the category. But we also don't want to get in the way. Like this shouldn't be them saying, hey, we want to submit this to get approval for it. It should be them saying, this is what we spent in the past quarter that's kind of been confirmed by the state grantee as well. However, those state processes work.
This is
This
Miss
is
Taylor.
Oh, go ahead. Okay.
Go ahead,
Okay, well, I
Stephanie.
was going to say, this is Stephanie from Idaho. I think one of the challenges that I'm seeing in Idaho with the CARES Act funding is that not everybody does this. Some people give it upfront. We do subgrants or it's cost-based reimbursement. So they spend the money, then they invoice for it.
Mhm.
They'll ask before they invoice for it. So if there's anything nebulous, I ask Ship TA, but otherwise if it's straightforward, we go ahead. So we
Mhm.
don't report to the HB until after everything's been approved and things like that. But what I've found is that there's a big challenge with the timing. So they can
Mhm.
invoice whenever they want, but there's always quarterly reporting. So sometimes they will report on something this quarter, but they've spent the funding. It turns out that they found something that they spent it like 2 or 3 quarters before that.
Mhm.
So then I'm having to make comments in the existing quarterly report about something that wasn't put in a previous report because they could invoice at any time, right? So that's part of the challenge. And so I'm having to do a lot of back and forth to make sure that the dollars
Mhm.
that they're reporting on currently match. And then I think it's just a matter of making sure that there's no errors. So there is a lot of work done on the reporting piece.
Mhm.
And my fear of having them do web-based is just the discrepancies and then having
Yeah.
to follow back up. If they're going to already be reporting equipment and minor AR to me, then to me, it just, I don't want to speak for the group, but I just think it may become actually more burdensome to have that removed and then have to answer questions on the back end about
Yeah.
it. That's my only
Yeah.
concern.
Yeah, and I think it's the balance of what is useful for us in getting information kind of for that high level report out on how the funding's being spent and kind of along the way, what activities the money's being spent around. So, it seems like these Excel spreadsheets for the CARES Act have been useful for states for kind of your tracking and accountability there. But from the poor perspective, we're not using it for that kind of integrity checking of, did the hospital spend the money that they said they would? Like that's kind of what you're doing at your level. And so then we're getting these reports on a quarterly basis that are, it takes us more time than we had planned to kind of run those high level analysis of like, here's broadly the categories that hospitals are spending money in. So, I wonder if it's better for us to just, because basically what we want is just like high level, and we don't even need the financial data in the system. If it sounds like that might be complicating your efforts at the state level, if we're just able to capture, here's the different categories that hospitals are funding through this ARP money.
Christy, I think what I'm hearing a lot of us say is that we are concerned that if they spend it on, let's say they just check a box and say, okay, we did mitigation efforts. And we spent, if you're not collecting the amount, it's just like, we spent money on mitigation efforts. Okay, that's totally fine. What if they're not? What if it doesn't meet your definition? For instance, all those questions I asked, the 15 questions.
Yeah.
What if it's not, and if the hospital didn't ask the state first, and because they have access to the spreadsheet, they go in, the portal, they just go in, they put their stuff in there. Who's that going to fall on? And I think that's or just, I think, reducing the anxiety about if this is allowed or not. So trying to figure out and if we each as states need to create that part of the process for ourselves, that I guess that's something that I can deal with here. I just need to know that that's what's expected.
Yeah. Okay. This is really helpful conversation because from the poor perspective, we're not seeing this portal as like you're submitting and then we're saying, yep, like all of these are allowable and we approve it from the federal perspective. It's more informational to roll up at a higher level just to give that snapshot of here's how money is being spent across the program. I think, however you set up at the state level, and we're happy to help continue to answer those questions that you get in from hospitals, but, and if there's more information that we can provide that you can share with your hospitals around what's allowable or not, And we're gonna, as I mentioned, work with Task to kind of see how we can make things easy to use on the Task website. But all of that we want to make sure is happening for them to spend the money in the way that we intend it to. But that's outside from our perspective of, what they're reporting in. So,
Hey, Christy, this
yep.
is Sherry. This is Sherry from Texas. So I concur with everyone who's talked about that. I find this very problematic in terms of the number of hospitals that we have, and then our accountability as a state to be accountable for, audit purposes and, disallowing certain things that, that have come in on invoices, we know, and then disallowing it. If you're wanting high level information so that you can report to Congress and do everything, wouldn't it be, would an idea be that we, as we get the quarterly, I don't know how you're wanting us to report, but if we do it kind of similar to COVID SHIP, we would have the activities come in, we've reviewed the invoices, we've approved what the activities that they've done. And then we would go in and check in your portal. We would check those activities off for those hospitals. I don't know if you're going to have a list of hospitals in there. We would check it off. But the hospitals, if you're because I know I read that you're wanting testing information. So then the hospitals would also provide us the number of tests that they did on a quarter basis or monthly. And then we would go in. To me, if that's what you're needing, I think the procedure wise, it would make more sense for me, once we've approved everything, if you're wanting it into some portal, then we could go in and do that.
Okay, great. So it sounds like what I'm hearing, and please use the chat to share your opinions, that it would be much easier to just have SHIP coordinators enter into this web-based system and you collect the information from your hospitals. So
yes.
From what the comments we've already heard, that's what it seems like the answer is. So just put in the chat. Okay, so it's looking, okay, so that's totally doable. We were trying to reduce the burden, but I can understand all these other concerns and kind of the other factors that we weren't thinking about from our needs. So that works. So I know we're almost at time. So this has been a really helpful conversation. So I know there were a couple questions we didn't get to, but we'll send out FAQs. And then, we're still working through the reporting process. So we'll make sure to, I guess, for next steps.
The only thing, this is Sherry again, please do not make it monthly, monthly reporting. That will kill me.
Okay.
I mean,
I
mean, quarterly, I always have to ask for extensions with 132 hospitals. So please do not make it monthly. That's my a big request.
I'm feeling, this is Kyle in Wyoming, and I'm feeling that way too, and I understand what everyone's saying about, like, as the SHIP program manager, having the reporting come to me, because either way I have to follow up with them, right? Make sure they're reporting. But the burden, I'm one person in one office, and the burden is just like mounting on my shoulders right now. So because, the consideration of, yes, we want to get these funds out. Yes, we want everybody to be responsible and be held accountable for using these funds in the way they're intended, but also not burdening any of us with all of that. And it's sounding like either way it's going to be a burden, and that's really scary.
Yeah.
This
okay. So I see there's been a lot of comments in the chat. And if you have comments about the kind of hospital reporting piece, feel free to also send them to the SHIP testing email address and just put in the subject line, like testing suggestion or testing, or the reporting suggestion, reporting concern, and we'll continue to look at those and then keep all of you looped in as we learn more information about what we're able to, because it's really helpful to have this conversation kind of going in as we start to initiate those conversations. But then we do want to make sure to loop back with you before we finalize anything, just to make sure, given whatever constraints we're working in, it kind of addresses all your concerns that you have now and try as much as we can to minimize the burden. Okay, I think I interrupted someone who was trying to make a comment.
That was me. This is Misty in Missouri. So when this first came out, our initial thoughts was to do an attestation with the hospitals that we would just give the money up front and then they attest to that they would only spend the funds on allowable expenses. We can't do that now because we can only do an attestation with our state policy if they don't have to report anything to us. But so since they have to report the equipment and the minor A&R, we couldn't do that. But would that kind of take care of the issue of allowable expenses? Like if they attest to that they know that what they're spending the funds on is allowable?
Yeah, I would, whatever your state processes are is what you should go with. And then if there's anything, again, that would be helpful, just messaging that we can kind of craft that would be useful for you or any other states to just share out, like sharing the link or the FAQs, or, you know, we could create kind of a more hospital specific FAQ and then working with task on the allowable activities. Just let us know how we can set things up to facilitate your role as SHIP program coordinators working with your hospitals. So, I mean, with all of this, it's really getting the hospitals thinking, how does something directly tie into what these activities are? So if they're able to do that, then most likely it's allowable. If it's kind of a stretch of, you know, this would be great for our hospital and we're going to try to see how we can fit it in under this, those are the things where we end up having to say, no, that's not allowable because there's just not that strong direct connection to it. So, okay, let me just pull up the chat.
Christy, this is Stephanie. Is there going to be any talk about just sort of the interface between this funding and the RHC testing funding and just how to sort of help hospitals that own RHCs navigate?
Yeah, thanks for that question. And I know there's probably more we can talk about on that. So if you have any specific ideas on that now, put it in the chat or again, follow up with the SHIP testing email. We've been trying to coordinate behind the scenes with our colleagues in the policy research division, kind of making sure that there's alignment there. But I know there's more we can do kind of rolling out just to provide more clarity, both, you know, for state offices who I know are involved kind of from that RHC component and then for the SHIP work. So if you have questions that you're kind of thinking of already or that you're getting from RHCs or, you know, the hospitals that have RHCs, let us know. And then we can work with our colleagues in PRD to try to do kind of more coordinated effort to address those questions.
Thank you.
Okay. Great. So appreciate all of your questions and really appreciate you being open about your concerns on the reporting. That has been really helpful to hear. So for next steps, we'll schedule another call after the notices of award go out, kind of that kickoff call to talk through just the high level work plan that will be do kind of similar to the CARES Act and the budget, and then get more into detail on the reporting requirements then. And then kind of parallel to that, also be working on this kind of the hospital activity reporting section, and we'll keep you looped in as to how that progresses as well. So is there any topic that I didn't talk about now or didn't address as to be followed up on as a topic that you want to make sure we get information to you on? Okay. Well, thank you again so much. We'll be following up with the updated FAQs document. And if you have any additional questions or thoughts, shiptesting@hrsa.gov. So enjoy the rest of your day and have a great weekend. And June 9th, not July 9th. We look forward to getting your list of hospitals in. So thank you so much. Have a great day.
Thanks,
Thank
Chrissy.
you.